Okay, thank you for joining me for another Miami Med Gym podcast. I'm Jose Almeida. And sorry, the last one was a couple months ago. As they say, life happens. A lot has been going on, but I'm glad to get back on track here. So, what's different is I've done a course in functional medicine, an online course. What is functional medicine? It's more on, people call it homeopathic medicine. It's really not. It's basically just focusing on lifestyle, nutrition, exercise, and causative factors or the root of diseases for treatment. It should work in parallel with conventional medicine. Of course, I'm conventional medicine trained. I'm an MD. Got my been a doctor for 32 years now, and specialize in vascular surgery. So conventional medicine, people think more of prescriptions and medications, surgery. This functional medicine gets a focus more on the background of things that may have caused illness or inflammation, such as even going back to childhood trauma and stress, toxins, how we eat. So, so what I'm going to do today is I bring up some slides here, is just kind of go through an overview of functional medicine, what I've learned, and share it with you. And then, going forward, the idea is we're really trying to get this medical gym concept really going. And the audience here is our patients and our gym members, and how we're transforming the gym to a private gym or a medical gym. So let me just get going with this. And the growth of functional medicine, episode 16, Miami Med Gym. So most of these slides I've taken from materials that I've downloaded from my course from the Institute of Functional Medicine. So that's just in the way of disclosure. Some of these slides come from a talk from Patrick Hanaway. So the future of medicine is functional medicine. I'm thinking that's probably true. What causes imbalances, and look at things from a systemic point of view instead of labeling people with the disease. So again, just background on me. I'm a vascular surgeon, been in private practice for 25 years, married with 4 kids. And I've been a competitive bodybuilder for 20 years. I think I'm finally done with that. The last show last year. So I started organized sports at the age of 8, played ball. Was a high school varsity letterman in football and wrestling, and that got me to weight training. So I'm just kind of showing the progression of why I've instituted this whole functional medicine into my vascular surgery practice. It comes from this background. So I've been, hitting the gym for 45 years now, competitive bodybuilding for 20 years. I did 17 shows, so on stage. Been doing karate for 27 years. I still do that. So now as I turn 60, the shift is away from, this sort of thing, getting on stage, and on health and longevity. So I've learned a lot through bodybuilding about eating. Preparing for these shows requires some strict diet and discipline. So that's kind of what I'm trying to bring to the table here with this background of surgery and bodybuilding, what a medical gym would look like, helping people to change their lifestyle. And the crux of that is eating correctly and doing some movement. If you don't do those two things, that seems to be the baseline for developing illness. And it's hard for people for whatever reason. So I like this because this is really what we're learning, how the environment affects your body, but the role of genes. So, when I was going through medical school, the extent of our genetic probably knowledge back then, and what we learned about genes was the old, what DNA is, how it is the blueprint for what our cells do, what proteins get produced, but not so much what we learn now, how uh, all the feedback that goes into our genes. The genes don't change, but the regulation of the genes can change. So there are things, there's a thing called epigenetics, whereby epigenome up here, whereby processes, and I'm not going to get into, but things like methylation, acetylation, there are ways that the body can uh, express different genes or quiet certain genes based on the environment or inflammation or what the body is seeing. So how we respond going forward, our body can actually change the way our genes get expressed. That's relatively new in the last 10, 20 years. And certainly we're learning more about that as we go forward. So modern medicine or functional medicine, I think there's going to be more focus on these things, how genes are translated into our health and disease patterns. The microbiome, we've talked about this in previous podcasts. We have about 100 trillion microbes that coexist with us, mostly in our gut, but also in our skin. And we're learning how the microbiome, they also produce metabolites, or for example, they can produce hormones or chemicals or peptides that our body uses as signaling mechanisms. So there is actually a symbiotic relationship. We need these microbiota are the bugs. Microbiome is all the genetic information contained within the bugs. We need these microbiota to be in a certain balance so that we're healthy. Exposome, things that we're exposed to in the environment, toxins, etc., also affect which genes get turned on and off. Epigenetics, we already mentioned how our genes get expressed based on environmental signaling. Nutrition, and how nutrients and phytochemicals speak to our genes. And this last one, social networks, emotions, stress, how these affect our genes and our health. So I think the field of medicine will be moving more in this direction. Acute care is not going away. You have a major injury or a major problem, you go to a hospital and get treated with conventional medicine, antibiotics, medications, surgery, whatever it is. But on the outpatient side, keeping people well, I think a lot of this has been ignored in the past, and it will be emphasized in the future. Now, this is important because in general, our bodies work on feedback, positive and negative feedback. So let's just take this example of the stress response system. Our brain, our hypothalamus is at the base of the brain, and the hypothalamus communicates with the pituitary gland right around here, and hormones release. So for example, corticotropin releasing hormone released by the hypothalamus will talk to the pituitary to produce ACTH, adrenocorticotropic hormone, to go down to the adrenal glands and signal them to produce or inhibit the production of cortisol, which is our main stress hormone. If there's a lot of cortisol around, it will feed back. It will tell the hypothalamus, hey, we've got tons of cortisol in the system right now. We don't need to produce more. So in that case, high cortisol will inhibit the production of CRH, corticotropin releasing hormone. If, on the other hand, there's very little cortisol in the system, and a bear shows up on your front door, that's going to stimulate a lot of cortisol production, because low cortisol will talk to the hypothalamus. Other mechanisms will tell the hypothalamus there's a threat outside. We need to produce stress hormones, and then this will cause the signaling as we've described. So it's just to show the hypothalamic pituitary adrenal axis in this case. Stress can lead to increased cortisol formation. Stress leads to inflammation. It can cause inhibition of sexual steroids, etc. So this is just an example of how our hormones function by positive and negative feedback, usually on the brain. As we've mentioned, these sort of things, underlying causes, toxins, allergens, microbes, poor nutrition, stress, will lead to changes in gene expression. And this sets up balances or imbalances in our system. So assimilation of nutrients, for example, defense and repair or immune system, how it's affected positively or negatively. Energy produced in our mitochondria. We've talked about this in the past. ATP is our energy currency. What causes increased or decreased energy? If you have toxins entering the body, how is this changing gene expression on ATP production? Transport, structural, mental, emotional. So this is kind of the new, the imbalances that occur in the system, not labeling things as much as you have heart disease, you have this infection, that infection, you're labeled demented. The focus is more on looking at what caused the imbalances and trying to fix them, always starting with lifestyle modification. So ATMs, or antecedents, triggers, and mediators, is a format that functional medicine uses in the way they approach and interact with patients. So antecedents would be things that have happened in the past, exposures, nutrition, lifestyle, what has set the patient up to respond to particular triggers. Triggers can be infections, allergens, trauma, toxins, and then what happens in the body in response to triggers, how our inflammatory system is activated, which inflammatory mediators. We have many. We've talked about some of these things in previous podcasts, but again, today's more of an overview. So these are chemicals that the body produces in response to triggers. And these chemicals can be in the form of interleukins, hormones, peptides, many things, neurotransmitters, free radicals, which can be damaging when out of balance, and how these feedback and affect our health. Antecedents. So we've touched this already. So the functional medicine format is the ATMs. These are the antecedents. How does family history, genetic predisposition affect any balances in your system? Previous trauma, whether emotional or a previous car accident that caused massive injury, sexual abuse, gut issues. And one of the things that I've learned in functional medicine, when in doubt, turn to the gut first. So people that are having any type of bloating or trouble processing food, our gut has a big neurologic network. It's like another brain inside of the gut, and it affects our system in a major way. Of course, also in the gut are many bacteria, our microbiome. So a lot of what can be happening to take our system out of balance and make us sick, and for whatever cause, always look towards the reason for this inflammation. Why are they gaining weight? Why are they now hypertensive? Why did they have a heart attack? Um, so asking why, that's really what this is about. And the gut seems to be a major one, in addition to toxins, etc. Um, Triggers we've touched on. So previous trauma, previous infections, memories that can cause stress, relationships, previous surgery. These can all be triggers to responses that our bodies produce, which can either cause wellness or sickness. Mediators. So the big one now, and we'll touch a little more on this, and we've touched on in the past, visceral fat being inflammatory. So metabolic syndrome, type 2 diabetes, the obesity crisis. This is a big one in our country that we're finding out is mostly from processed food, which has a lot of sugar. This is all inflammatory, and it all feeds on itself. As one gets more visceral fat, one starts to develop insulin resistance and diabetes, and then high blood pressure. So controlling the size of the abdominal, the waist, is a big player in our overall health. So being obese would be a mediator, something that, if not addressed, one will continue to develop inflammation and illness. So as far as in our practice, if you've heard from previous podcasts, we have a big emphasis on nutrition and mechanical load resistance training, and that's where my background has really taken me, from sports and preparing for bodybuilding shows. Bodybuilders are really focused on food, the macros, proteins, carbohydrates, and fats, and really have learned how to control, mostly through carbohydrate manipulation, getting lean, changing our body composition. And all the studies coming out are emphasizing that muscle is a big player in overall health. You need muscle to age well, to fight off sickness. A lot of muscle development is by stimulating the muscle with mechanical load, like resistance training, and what you feed the muscle. And of course, this will feedback on our genes, which get transcribed, what proteins will get produced. We've touched on mTOR before. I'm not going to go into it now, but that's the on-off switch for muscles protein synthesis in skeletal muscle. mTOR has other functions in other tissues, like the liver, for example. So this would be an example of how nutrition or mechanical load will stimulate or inhibit genes that can cause muscle health. We talk about hormones. Testosterone is a big one, thyroid is a big one, and how these affect our health. So that's a big one for us, lifestyle changes, and what we're trying to do here with the Midtown Body side of the practice, which is our a gym in Midtown Miami, where we have trainers, we have nutritional counseling. Here in the Brickell office, we have a DEXA machine where we can get body composition on folks. The nurse practitioner dedicated to figuring out these ATMs, antecedents, triggers, and mediators in our wellness program of how we can help individuals. And most of what we're seeing are people that are overweight and trying to get them to change their behaviors. So as we move forward, lifestyle medicine is a big part of functional medicine. What I learned in the course, changing behavior, and it's difficult for people. Coaches help. Checking in with the coach every month. That's critical to keep people on track. The health coach, well, what did you eat this week? Tell me, show me. Let's put you on the scale. In 3 months, let's do a DEXA scan on you. That'll tell us if you've gained any muscle or gained fat or lost fat. That's the most sensitive way of seeing what you're really doing. You can't lie to the DEXA scanner. You can lie to your coach, you can lie to yourself, but you can't lie to the DEXA scanner. Changing your stress, sleep is a big one. Smoking obviously is a negative one that we need to stop. Movement versus exercise. So exercise seems to be a word that is going out of favor and being replaced by movement. Exercise gives a connotation that you have to be in the gym, pounding weights. A lot of people don't like that. It's really about movement. You can do things at home. Just walking is a good start. But there's a lot of research now showing that lack of movement is terrible for health. Being sedentary is bad. Sitting is now a risk factor for type 2 diabetes, insulin resistance, and all-cause mortality. So this next slide is pretty shocking. Research has provided that every hour spent sitting watching TV takes 22 minutes off your life. It's reported in the British Journal of Sports Medicine. 2009, 17,000 Canadians found that those who sat were 50% more likely to die by their next doctor follow-up. Pretty hard and sobering statistics there. If you have a sedentary lifestyle, you're slowly killing yourself, is what this slide tells us. The sedentary and standard American diet. So this is just an example, and we've talked about this in previous podcasts, but this seems to be a big crux of what's going on in the United States and even the world, is this diet, processed food. So a person sitting in front of a computer all day, a sedentary person, can use about 130 grams of carbs per day. They can burn it. If you're taking in more than that, and the average person is taking about 300 grams of carbs, and that's what processed food is. It's mostly sugars and additives that make food palatable. You can gobble, a bag of Oreos easily, but to try and gobble 30 ounces of chicken is very difficult. So protein, which should be the number one thing you focus on, your protein intake, and then balance out the rest of your calories with carbs and fats. But what's going on in this country is that the carbs dominate. So loading the body, for example, on a daily basis with 300 grams of carbs, and you're sedentary, you're not an active person, the body will convert this to fat. Continuously increasing your carbs. So our body needs to dispose of sugar, dispose of carbs. High sugar in our bloodstream for 2 hours is the definition of diabetes. A lot of glucose disposal, getting rid of the glucose in the bloodstream, occurs in skeletal muscle, in muscle. So muscle is a big player. That's why you hear about 10-minute walks after you eat. That gets movement going and gets the muscle active and starting to get rid of glucose so it doesn't get converted to fat. However, if you're not doing that, if you're not active, as you pump more glucose into the body, that tells the body to release insulin from the pancreas. Insulin is what pushes glucose into the cells and out of the bloodstream. If you're pushing carbs that you're not burning, you're going to keep having to produce more and more insulin to get rid of those carbohydrates, to get rid of that sugar. And that's going to go into the fat. As that happens, the cells become more resistant. They start not listening to the insulin signal, and insulin resistance occurs. So that means that the body now has to keep pushing more and more insulin to deal with the sugar, and eventually it'll just damage the pancreas, which is the organ that produces insulin. And then we get diabetes or type 2 diabetes. So this is what's happening with our standard American diet, and why folks are getting sick all the time with, and it doesn't have to be obesity, but obesity plays a big role in this metabolic syndrome in type 2 diabetes. So nutrition is a big player, getting people to eat whole foods, lots of vegetables. We've talked about this in previous podcasts. Nutrition is such an important part of staying healthy. Notice we don't see, and I've heard this on our previous podcast, anything that comes in a box or a bag with a barcode is bad. So that just tells you it's processed food. There's additives, sugars. This is the sort of thing that's causing the body to keep pumping out insulin to get rid of these processed sugars, leading to insulin resistance and diabetes. Stress is a big one. A job where you're not happy, a bad relationship. Stress is increasing your cortisol. Cortisol, when out of balance, it's unhealthy, causes a lot of inflammation, and can cause system imbalance. So this is a big one. Sleep is an important thing we're finding. Getting the 8 hours of sleep helps to mitigate stress and get us back, get our cortisol levels down, and getting back into a balanced system. Stress triggers, examples, loss of a loved one, that's very stressful. Loss of a job, where your money going to come in, previous trauma. All these are triggers that can continue to amplify in the body and not allow folks to be healthy. So stress is emphasized in functional medicine, where not so much in the past conventional medicine, the way I learned in medical school. Relationships we've talked about. Poor relationships cause stress. Ongoing stress can cause bad decisions. We all know this. So managing our relationships, especially our loved ones, learning how to communicate with our loved ones to mitigate stress, important skills that need to be learned. A lot of people seek therapy for this, coaches. The point that is on this slide is emphasizing functional medicine as a modifiable lifestyle factor, that you need to work on your relationships, get things in balance for good health going forward. And again, we've mentioned epigenetics. So these are mechanisms. This would be a chromosome, how it can open up so that genes can be transcribed to produce proteins, or it can be shrunken down and hide genes that we don't want to be expressed. So some mechanisms you'll hear about that the body does is acetylation, which is adding an acetyl group or adding a methyl group to genes to either turn on the expression of the gene to produce a certain protein, or to turn off the gene to not express a certain protein. So our environment, our nutrition, stress can all affect what genes get turned on and off. So this is epigenetics. Epigenetics can also get passed down to your offspring. So as they say, things that your grandfather did pass down to your father can get passed down to you just by genetic expression changes that occurred in your grandfather's life. It can actually be an antecedent. We would call that family history into the way you express yourself now as an individual, and how your health may be affected. A year in space puts astronauts' immune system on high alert, changes gene activity. This is an example of how the environment can change gene activity. So this is now being proven with basic science. It's not anything wonky or kooky, or it's real. It's real basic science supported by clinical studies and basic science studies. And we've talked about how food can affect gene expression, nutrigenomics. So if you hear terms like this, again, these are all things that are being supported with clinical studies. Processed food is bad, and real food is what we need to be taking. Lots of vegetables, using the whole color spectrum of red, greens, blues. That's where different vitamins and minerals come in, which are important cofactors for our enzymes for energy production. So a good diet is huge. So as we wrap up here, what do you need to get in order to thrive? Proper nutrition, vitamins and minerals, light, water, air, movement, sleep, giving yourself time to rebuild and restore. Love, community, connection, meaning, purpose. These are new concepts that are showing to be real players in our overall health. So as we get back to where we started, all these things affect your health, and we're just learning more about how the environment actually causes changes in gene expression and what proteins get produced, and how this affects our balances or imbalances. So as we go forward with the podcast, this was actually episode 16, and this is a misnomer. I'd like to thank all of you that have listened to our podcast so far and our subscribers. Again, the focus has been our patients and our gym members, but hopefully, as I keep doing these, we'll get people to get excited about functional medicine and taking care of themselves. Okay, so signing off for now. You can go to our YouTube channel. We're called Miami Med Gym Podcast. Thank you.